Before we begin, this video is general health education, not personal medical advice. This is educational content, not medical advice. Always consult a healthcare provider for personalized guidance. Your skin is remarkably resilient. It repairs itself after damage through a process called wound healing. This involves cells moving to the site of injury, new tissue growing, and the skin restoring its barrier function. We'll explore how this works naturally and when to support it without interfering. When your skin is cut or burned, it doesn't heal instantly. It follows a precise four-step process. First, hemostasis stops bleeding by forming clots, like nature's bandage. Next, inflammation cleans debris and fights infection with white blood cells. Then, new skin cells grow to fill the gap while blood vessels regenerate. Finally, remodeling strengthens the area over weeks or months. Those scars may form if healing is delayed. Your skin's repair process can speed up or slow down due to factors like age and chronic conditions such as diabetes. As we age, stem cells that rebuild tissue become less active, slowing healing. Chronic inflammation from conditions like diabetes can delay cleanup and lead to pathological fibrosis when scar tissue becomes thick, stiff, and dysfunctional, impairing normal skin function. Environmental factors also play a role. Excessive UV exposure damages skin cells, while proper nutrition supports repair without overpromising results. Picking a scab removes its protective barrier, delaying healing and increasing infection risk. A 2018 study in JAMA Dermatology found minor scab picking may not always slow healing, but raises infection chances. Always avoid it unless advised by a doctor. Instead, keep wounds clean, moist, and covered with a bandage to support natural repair. Your skin heals best when given space to work. Clean wounds gently with soap and water, then cover loosely with a bandage. This keeps the area moist without trapping heat or bacteria. Avoid tight clothing that rubs, as friction can irritate new tissue and slow repair. Stay hydrated to support your body's nutrient delivery to skin cells, though no studies prove excess hydration speeds healing. H3. Resist picking at scabs unless a doctor advises it. Disrupting the barrier can delay healing or cause scarring. Trust your skin's process. Interfering often does more harm than good. When your skin is cut or burned, over-the-counter, OTC, basics can help without slowing repair. Antiseptics like hydrogen peroxide or alcohol-based wipes kill germs, but should only be used briefly. Too much can dry out the wound and delay healing. Bandages keep wounds moist and clean, supporting natural repair, but avoid tight ones that trap heat or bacteria. If a cut is deep, won't stop bleeding after 10 minutes of pressure, or shows signs of infection like redness spreading beyond the area, see a doctor. OTC products are safe when used as directed, but always follow label instructions to avoid mistakes. When your skin heals from a cut or burn, it often leaves a scar, a patch of fibrosis, where new tissue replaces the damaged area. This is normal and happens when cells like mesenchymal stem cells, MSCs, help rebuild skin. But sometimes scarring can become problematic if healing doesn't close properly due to chronic inflammation or disease. While research on MSCs shows promise for regeneration, current therapies are still limited. Scars that raise, itch, or cause pain may need medical attention, but mild scarring is usually just your body's way of repairing itself. For deep cuts, doctors choose between sutures, traditional stitches, and modern adhesives like Ubran, a glue that bonds skin. A 2025 study found both work well for head and facial wounds, but adhesives cause fewer issues like irritation or infection. Sutures are still better for high-tension areas where precision matters, like joints. However, neither method replaces proper care, cleaning the wound, keeping it moist enough but not too wet, and avoiding tight closures to prevent scarring. This balance helps your skin heal smoothly. Your skin's repair process isn't just about what happens at the wound site. It's also shaped by your lifestyle. Sleep, stress, and even your environment can influence how well your skin heals without scarring. For example, poor sleep or chronic stress may delay healing because they affect your immune response and inflammation levels. While these factors don't replace proper medical care for deep cuts or burns, they can support your skin's natural repair when combined with standard treatments like keeping wounds clean and moist. Always consult a healthcare provider if you notice signs of problematic scarring, such as raised, itchy, or painful areas. Why our skin is great at healing itself. Some wounds need extra help like deep cuts, burns, or those that don't improve in weeks. Signs like redness spreading beyond the wound, pus, swelling, or pain can mean infection, which slows healing and may need antibiotics. Chronic stress or poor sleep can also delay repair by affecting your immune response, but they won't replace proper medical care for serious injuries. Always check with a doctor if you see raised, itchy, or painful scars, as these might need treatment to prevent long-term issues. Skin repair remains a complex puzzle. Scientists study special stem cells called MSCs, which may improve deep wound healing, but their exact role isn't fully understood yet. Sometimes scars thicken into problematic fibrosis, and while research is ongoing, current treatments are limited. More studies are needed to support natural healing without interfering, balancing progress with caution. This video is for educational purposes only. It's not medical advice. If your skin doesn't heal properly or shows signs like persistent redness, swelling, or pain, see a doctor. They can check for infections or other issues that might need treatment. Always share details about your symptoms, medications, or supplements to help them provide the best care. Now, what questions do you have about skin healing? Share them below. Remember, this is general health education, not personal medical advice. For individual